Okay, so this is week 2 of bones. So we got our nasal bones, are these small little wedges that form the bridge of your nose. If you want to see one by itself, it's not super important, but that's a nasal bone. Then on to the maxillae. So the maxilla is the top part of your jaw. So if you're looking on if you're looking there, that's going to be your maxillae. So your maxillary sinus, if you're looking at a sagittal section, is whomp, that big hole in there. The palatine process is your hard palate. So it's this whole section right here. As you can see, it juts off of the main part of the bone. Palatine process. Then alveolar process is just this ridge where your teeth fit into, and the alveoli are the individual sockets that your teeth fit into.
There you go.
Infraorbital foramen, infra being below, foramen being a hole, orbital being your eye, so obviously it's this hole directly below your eye. And then inferior orbital fissure is right there. So you have the superior orbital fissure, inferior orbital fissure. Then the zygomatic bone, not too much that's super important about this. It's going to be this bone here that sort of makes up the peak of your cheekbone. The zygomatic arch, as we saw last week, is this whole arch right here, and the temporal process is a process sticking out from the zygomatic bone towards the temporal bone. So it's this half of the zygomatic arch. The mandible is going to be your lower jaw. So the body of it is your chin. The rami, one ramus is this part of your jaw that sticks up from the angle, which is where the angle changes. So you have this, like, what is that, maybe like 120 degree angle there. The condylar process is this right here. So it's a condyle because it is a smooth round surface that articulates with the articular condyle of the temporal bone. The coronoid process is this right here. Coronoid being sort of like, what was it? It was like flat or like triangular kind of thing. I don't know, but that's the coronoid process. Mandibular notch is right here, so it's between the condylar process and the coronoid process. The alveolar process, again, same thing as the maxillae, is just this ridge that your teeth fit into. The alveoli are the sockets that the teeth go into. Mental foramen was the foramen on your chin. And then mandibular foramen is this foramen back here. So there's a right and a left for both of those. And that is the mandible. Now the lacrimal bones are super tiny. Not super important that you know what they look like by themselves, but those are lacrimal bones. If you're looking in the skull, the lacrimal bones are in between, so it's going to be that small section right there. So you have your nasal bone, and then this part of the maxilla, and then you have the lacrimal bone, and then back here, I believe, is the ethmoid. So it's in between the maxilla part of the orbital cavity and the ethmoid part of the orbital cavity is the lacrimal bone. So then the palatine, generally it's kind of weird because we kind of refer to this whole part as the palatine, even though this is part of the maxilla. Just like call this the whole palatine is your palate. And the horizontal plate is this back section right here where it's obviously horizontal, sort of a flat plane. And that is your palatine. Oh, we never went over the inferior nasal conchae, but I believe... Are those them?
We can see them. Yeah, they are.
Okay, so those are your inferior nasal conchae. Yeah, because that's the perpendicular plate and that's the superior, so there's inferior.
Okay.
So those are their own bones. And then the vomer is... Where was that? Okay. One moment while we look up the vomer.
Can we pause it?
Oh,
We're going? All right, we're
Okay,
good.
cool. Sorry for the break. So the perpendicular plate is the top half of this line down the center of your nose, and the vomer is the bottom of it, and it extends backwards into the skull here. So that's the vomer. So it goes whoop and then straight down and forms the bottom of the perpendicular plate. Sorry if I was holding
Cool.
it.
No, you're good.
Next is the hyoid. So here we've got the hyoid. It sits right, like if you've got the skull, it sits here in your neck, sort of.
Do you want to look at the skeleton?
Yeah.
Just to show.
So to show you where it would be on a skeleton, hyoid bone is right in there. This little
Perfect.
ring right there, half ring. So the body of the hyoid is just this central piece right here. The greater cornu, a cornu is kind of a horn, you can think of it. This is the greater cornu, this whole process here, and then that is the lesser cornu, that tiny little thing jutting out there. Okay, on to the vertebral column. So if we look at the skeleton, the whole column obviously is your spine. There are approximately 30. A good way to remember the numbers is breakfast, lunch, and dinner. So 7, you have breakfast, 7 cervical, 12 thoracic, you have lunch at 12, and then 5 lumbar, you have dinner at 5. The atlas is the most superior vertebra. It articulates directly with the occipital condyles, I think they are.
Derek, move that to the side a little bit.
So it's right there. I actually have an example of an atlas here, but we'll get to that later. And then the axis is right below the atlas, so it's the second most superior vertebra. And then we've got the cervical, thoracic, lumbar, sacral, and coccygeal.
So sacral is this right here.
Yeah,
And
that
then
little plate, yeah.
coccygeal is the little thing right there.
Cool. So let's go ahead. Sure. So the body is this like disc-like portion. It's just the main section of it. The vertebral or neural arch is, like, say you're walking along, you're walking through. This is the arch here. So it's this arch right there. The pedicles, I believe,
We're right next to it, right?
were the walls of the arch. So this section around and this section around. The laminae, which I want to say is this. It's the flat section, yeah. So like if you're thinking a squama, sort of, it's not really a squama because it's not thin and flat, but it's this flat section right here. And yeah, if you want to double check.
Sure.
I think, yeah, I'm pretty sure that's the laminae.
We'll take your word for it.
The vertebral foramen vertebral foramen is where the spinal cord passes through. So it's just every single vertebra has a hole down the back of it. On the posterior side, the processes. So the spinous process is the one directly in the center that forms kind of like your dinosaur bones on your back.
So if you're looking at it right here,
Yeah. Vertebral processes going all the way down right in the middle of your spine, jutting out posteriorly. Transverse processes, transverse being the side, are these. Each one has 2, so the transverse processes poke out to the side. If you're looking on the spine, spinous process, transverse process. One thing to note, when you get up to the cervical spine, transverse processes go here, and then they kind of turn inward and are actually sort of more anterior, or I guess they're more lateral, but more anterior than they were on the lower ones. So those are the transverse processes for the cervical spine. Superior articular process is right here. So these articulate with the vertebra above it. That's the superior articular processes. And then inferior articular processes are right there. So they articulate with the spine below.
so if we're looking at it from like a normal angle,
So like if this is
superior
the
up
back,
top.
superior is up top, and then
Inferior.
inferior is on the anterior side
Okay.
of the inferior portion of the vertebra. Cool. So now we are on to the cervical spine. So, as you can see, a typical cervical spine. The small body is the body. It's just a little smaller than the rest of the vertebrae, so we call it the small body. Bifid spinous process, so it's still the spinous process, but bifid because it splits, it forks at the end. Transverse foramina, so this is the identifying feature of the cervical vertebrae. The transverse foramina poke directly through the transverse processes.
And only cervical vertebrae
Yes,
has them.
the identifying feature of that. Atlas, right here. So this is the atlas. It is directly inferior to the occipital bone.
Atlas is C1 or C2?
C1.
C1, okay.
These are the superior articular facets, so they articulate with the condyles, I believe they are, on the base of the occipital bone. The axis is the C2 vertebra, so directly below the atlas. This is the dens, and what the dens does is it allows you to rotate your head around. So the atlas articulates and allows you to nod your head up and down. The axis articulates and allows you to rotate your head left to right. Then on to the thoracic spine. So the thoracic vertebra looks pretty much just like a lumbar, maybe a difference in size, but the identifying feature of a thoracic vertebra is right here. This is the rib facet. So here is where the rib attaches. You can see it's a pretty broken rib, but this is a thoracic vertebra, and right in there is sort of where a rib attaches. It can be kind of hard to see on the different models, so just keep your eyes peeled, look in this general vicinity, and if you see something that looks like, a smooth facet for a rib to fit in, it's probably a thoracic. Besides that, it lists that it has a long spinous process, but don't rely on that, rely on the rib facets, and then it does not have any transverse foramina.
So no holes.
No holes. Well, there's the sentinel hole, but
Yeah,
no
but
side holes, yeah. Then the lumbar has no rib facets, so this whole section should just be continuous, smooth, nowhere for a rib to fit in. And it does not have any transverse. So it's basically you identify this by ruling out. So you say, does it have any transverse foramina? No, so it's not cervical. Does it have rib facets? No, so it's not thoracic, which means it must be lumbar. Then on to the sacrum. So the sacrum is directly below the lumbar spine. It is this fused sort of chunk of bone. The anterior surface, which is the front, is going to be this surface of the sacrum. I think this one actually has some extra foramina, so ignore those bottom ones. It should only have 4. But this is the anterior surface. Along the anterior surface, there should be 4 transverse lines, sort of in between these foramina. And what those are sort of remnants of intervertebral discs. So these used to be individual vertebrae, and then they fused together, and where they fused forms these lines. 4 sacral foramina, like I said, these are obviously foramina, they're just holes. There's 4 pairs of them. Posterior surface is the back, so it's this section here. You can see the medial sacral crest is sort of this, what was it? Yeah.
Yeah, it's easier to see on here.
Or was it right in the center? Or was it these 2 things there? I believe it was just this in the center.
Median,
Yeah. So the medial sacral crest, you can't really see it on this one here, but you can see it well on this skeleton, is you see how these spinous processes come down. It's sort of along that same line. If you just kind of follow it with your finger, it's these bumps there. And then the lateral sacral crest is what I was referring to previously. Or is it these ones there, or is it these ones? Okay, so it is on the lateral portion of the sacrum. Yeah. So those are the lateral sacral crest, medial sacral crest. Then the posterior sacral foramina are obviously the foramina viewed from the back, whereas the anterior would be the foramina viewed from the anterior surface. So right in there. Boop, boop, boop. Sorry, guys. And then the sacral hiatus. Oh, the sacral canal. So that's actually easier to see on this model. So the sacral canal, if you're looking from a superior view, it's right in there. So where the vertebral foramina were on the vertebrae, you just keep going down and it just goes whoop, straight down to there. And then where the sacral canal stops, which should be right there, is referred to as the sacral hiatus. So the canal continues all the way down and then it's no longer a canal, so it stops at the hiatus. And then the sacral cornu are these little horns that jut out right along the hiatus. So we have the hiatus there, and then a cornu. You have one on either side of the hiatus. The auricular surface is the bottom right there, and I believe it just forms the joint between the sacrum and the coccygeal. Then the superior articular facets are right here. So similarly to the anatomy of a vertebra, you had the superior articular processes. Where was that? Like up here on top, you had superior articular processes. It's kind of similar. These are the superior articular facets of the sacrum. And then that's the sacrum. So now we're on to the coccyx, which is actually, we didn't have one, so you can just view it here on the skeleton. So the coccygeal, coccyx is the base. The coccygeal is this whole section of 3 to 5 bones. The coccygeal cornu is right at the bottom, correct? Or no? Was it these guys? Do you remember the coccygeal cornu? It was up at the top?
It was kind of wedged in.
Oh, yeah, that's right. So the coccygeal cornu are this guy and this guy. They're right up at the top, sort of like wedged into the joint between the sacrum and the coccygeal bone. Okay, and that finishes... Oh, no, because we still have the sternum to do. So on the sternum by itself, we've got the manubrium, is this large section up here, sort of block. The jugular notch is right at the superior surface of the manubrium. The clavicular notch is where the clavicle fits in, obviously. So there's one on the left, one on the right. The body is just this main portion here, and then the xiphoid process is right down at the bottom. It's actually a little bit better down here. So, xiphoid process, body, manubrium, jugular notch in there, and then clavicular notches there. And then ribs. So where's a rib? Here's a rib. So this is a rib. You got your costal cartilage actually shown here. It's this sort of clearer part. So that's cartilage, obviously not bone, connecting your sternum to your ribs. Typical parts of a rib. The head is going to be on the posterior side, attaching to the vertebra. So the head is this like lump here. The facet,
so the head on here would be the back part, right?
Yeah. So
okay.
it's in here, sort of connected to the vertebrae. It's a little hard to see, but it's the most posterior part. Then the facet is going to be where the rib actually connects. So it's going to be this portion of the head right there, where it connects to the vertebrae and articulates. The neck is just below the head. It's this thinner portion there. So along here's the neck. The tubercle is this right here. So a tubercle is another articulating surface with the vertebrae. So you've got the facet and the tubercle that both articulate. And then the body is just the main portion of the rib. And that concludes the axial skeleton. So now we can go on to the appendicular. So looking at the girdles, the pectoral girdles, we've got the clavicle. So this is a left clavicle. Viewed from the anterior surface. So the left clavicle, you have the sternal extremity, which attaches to the sternum at the It's viewed this way, right?
It's an S. I think it's this way.
This way. Sorry. So that was the anterior surface. This is posterior. This is anterior. So it joins in with the clavicular guy right there. Sorry, up here. So that's where it attaches to the sternum. So sternal extremity, acromial extremity, coronoid tubercle, or conoid tubercle is right there. So it's on the acromial portion. And then costal tuberosity, it's not really a tuberosity in my opinion, but it's down here that attaches to the costal. So the costal cartilage.
Like this.
Yeah, so if you have it there, it's going to be down here. Here it's what joins up with this costal cartilage right in there. Yeah. Okay, so that's the clavicle, the scapula. So this is the left scapula viewed from the posterior.
So it would be the left.
It's along just like that.
Right there.
Left scapula on the posterior. So we have the spine of the clavicle is this section right here. You can think of a spine as a really high ridge. The acromion is this right here. So the acromion forms a joint with this, right? Yeah, so it forms a joint with the clavicle. That's the acromion. Clavicle. Acromion? Acromion, not acromion. Okay. Pronounce it acromion. The glenoid cavity is right here. So that's on the lateral superior surface of the scapula, and it forms a joint with the humerus right there. So the humerus fits in on the glenoid cavity. The body of the scapula is just this whole portion right here. So this long, sort of like lung-shaped portion, I guess, almost. So it excludes all of this. This is the body. The borders, so you've got the medial border is here. So that's towards the middle of the body. Lateral border towards the outside of the body, in this case, the left side of the body. And the superior border is right up here along the superior surface of the body. Okay, and then the inferior angle is actually going to be the inferior most portion of the scapula. So it makes an angle because I guess it just turns like that, but that's the inferior angle. The supraspinous fossa, supra being above, spinous being spine, fossa being depression. So this is the supraspinous fossa right there. Infraspinous being below, fossa being depression, is this whole section right here. So this is all referred to as the infraspinous fossa. Then the subscapular fossa, sub, I guess being like below or less than, you can think of, is on the inner surface of the scapula, this whole section. And that's for, like, those fossas are for muscle attachment. And then the coracoid process. So this was what was it? It was the acromion. The coracoid process is right in here. This is the coracoid process. Cool. And that is everything on the scapula. Then
Last
finish it
one,
off with humerus. So the head of the humerus is this round bump right at the top of the humerus. This one, if you're looking at it, this is a left humerus. Yes, left humerus, because the head is there, and we've got this thingy on the inside, which we'll get to later. So this is the head. Then the neck.
Humerus.
Oh, that's right?
Mm-hmm.
Because doesn't it match up? Oh, you're so right. You're looking at it
Notice
completely
these
wrong.
things.
Yeah.
Condyles always are on the anterior.
Okay, cool.
And that notch
Is on the posterior side. Okay. We were wrong.
Scratch like a minute of that.
Yeah. This is the right humerus. So the head is along this, or right up here.
Mm-hmm.
The anatomical neck is directly below the head. So you have this pretty clear round surface, anatomical neck, lines just below that surface, so it goes around the head like that. The surgical neck is the actual like neck of the bone from what we've talked about in class. So like epiphysis, diaphysis, the surgical neck is in between those two. The greater and lesser tubercles, I want to say the greater tubercle is this one. No, those are the epicondyles.
Weren't they in the back?
Oh, no, they were up here.
Oh,
up
yeah,
here.
there
So
you
the
go.
greater tubercle is on the lateral side. It's going to be larger, and then the lesser tubercle is more medial. It's
Yeah.
smaller than the greater tubercle, obviously. The intertubercular sulcus is right here. It's the space in between those two tubercles. And that's a little bit clearer on here. So if we're looking at the right one, we've got the greater tubercle, lesser tubercle, and intertubercular sulcus. There. Cool. Then on to the deltoid tuberosity. So the deltoid tuberosity is going to be this right here, I believe. So this rough surface sort of on the lateral side of the humerus, of the shaft of the humerus, and that's where the deltoid attaches. The capitulum was where the radius attaches. So this here is going to be the capitulum.
So if we're looking at it like anatomically,
yeah.
how would that be?
So head up here, this is the right humerus. You go down, it's the most lateral sort of tubercle here. It's called the capitulum there. And then the radial fossa is going to be this fossa directly above the capitulum.
I'm like trying to get to the center. There it is.
Yeah. So there's the capitulum and there's the radial fossa directly above it, superior to it. The trochlea, I think, was this right here. So, yeah. So it's where the ulna attaches. So the ulna articulates here with the trochlea, and the radius articulates here with the capitulum.
Ulna is medial, radial.
Ulna is medial, radius is lateral.
Yeah.
Yeah.
Okay.
Yeah. And then the coronoid fossa is this fossa right here, correct?
Coronoid fossa. Oh, yeah.
Yeah, I mean, that makes sense. It's right above the trochlea. So coronoid fossa is there.
And it would be like this thing right here.
Yeah,
pretty
so
much.
right there. It's like the
Okay.
antecubital. And then the olecranon fossa is the really big fossa in the back. So olecranon being your elbow. It's this big boy. And that's a good landmark to be able to figure out which direction is, or which side it is, left or right, because you always know the olecranon fossa is posterior, and then whichever direction the head is facing is going to be the side of the bone. So if you flip the olecranon process to the back, the head is pointing to the right, which means this is a right humerus. And I think that's, and then last but not least, we have the medial epicondyle and lateral epicondyle. Epicondyle being upon a condyle. And that's everything.